Minister Wells, colleagues, ladies and gentlemen of the media, and the public, good afternoon. Today, the Ministry of Health will provide you with the latest updates on the COVID-19 situation in our country. We begin this afternoon with the Honorable Minister Wells.
Good afternoon, members of the press, and good afternoon, Bahamas. Here is the latest update on COVID-19 as of Thursday, the 15th of October, 2020. 132 new cases were recorded on Thursday, bringing the total number of confirmed COVID-19 cases in the Bahamas to 5,517. There are 2,164 active cases. Currently, there are 107 hospitalized patients. 23 additional cases have recovered and have been released from care. The total amount of recoveries are now at 3,201, which is a recovery rate of some 58%. For the past 30 days, we have averaged 1.5 COVID-19 deaths each day. 3 deaths alone was reported yesterday. We remind the Bahamian people that COVID-19 is no respecter of persons. Ladies and gentlemen, so far, 26,150 samples have been tested. There are 565 tests completed yesterday, the 15th of October, 2020. I would like to point out that at the start of the second wave of COVID-19 in the Bahamas, a total of 2,540 tests had been completed as of the 13th of July, 2020. This number includes some follow-up testing on COVID-19 patients. Fast forward to yesterday, results of 26,150 tests were conducted, which shows that the Bahamas has ramped up an improved testing output of some 900%. My report of the COVID-19 numbers today, you would note, deviates from our usual format. We have heard the requests from the community for changes to the way we present data and information, and today we have done so. To more effectively improve and inform the public going forward, the Ministry of Health will phase in a more comprehensive COVID-19 update, similar to the one just presented. The COVID-19 dashboard in its current form will also be phased out. We encourage members of the community to continue to engage us through our clinic and our hospital community advocacy group and via our social media platforms. Through community partnerships, we can combat this pandemic. In addition to community partnerships, the government continues to embark on a multi-sectoral approach to decrease the spread of COVID-19. An additional 80 persons will be trained as contact tracers to assist in the vital task of identifying, contacting, and conducting further follow-up work on contacts of confirmed cases. This includes some 10 civil servants, 10 persons from the Ministry of Tourism, and an expected 60 persons who are employees of Bahamas Air. This will bring the total number of contact tracers to 111. These new persons will be trained to assist with the vital task of identifying, contacting, and conducting further follow-up work on contacts. Also, to streamline our COVID-19 efforts, I am pleased to announce the reactivation of the COVID-19 511 number, which went live yesterday, the 15th of October, 2020. This number will again act as the central portal for your COVID-19 questions, queries, and reports. Now, when you call 511, you will have access to contact tracers and medical personnel. You will also be able to inquire about work and travel protocols and report violations of public health measures or the emergency orders. Once you dial 511, listen to the recorded message, then select the number that best suits your needs. Throughout the COVID-19 response, consistent efforts have been made to increase the bed capacity at our healthcare facilities. We continue to work to ensure that COVID-19 patients, as well as patients with unrelated illnesses, have the needed space in our healthcare facilities. Through numerous capacity building exercises, the total bed capacity of COVID-19 cases is currently at 147 beds in country. This count includes New Providence facilities, of which South Beach Health Center has 10 beds currently in place with a capacity of 26. There is an additional space for 16 additional beds underneath tents supplied by the National Emergency Management Agency, NEMA. Princess Margaret Hospital has 70 beds, Doctors Hospital West has 22 beds, and Doctors Hospital East has 6 beds. This count also includes facilities in Grand Bahama. The Cancer Association of the Bahamas has 16 beds in Grand Bahama, and the Infectious Disease Center has 7 beds. All of this number, currently a total of 110 COVID-19 beds are occupied in country. Unfortunately, in our family islands, if a COVID-19 patient requires more than supportive care, they have to be airlifted to New Providence or Grand Bahama. Some of the hospitalized patients in those 110 beds are from our family islands. Ladies and gentlemen, I am pleased to report that the Samaritan's Purse International Relief Organization, under the invitation of our Prime Minister, has once again come to our country's aid. Following the devastating impact of Hurricane Dorian in 2019, Samaritan's Purse established a field hospital on Grand Bahama, where the Rand Memorial Hospital and numerous clinics were drastically impacted. They also initiated several additional projects on Grand Bahama and Abaco, which aid in the physical and emotional recovery efforts of the residents of those islands. Now, during this global pandemic, Samaritan's Purse will partner with the Ministry of Health and the Public Hospitals Authority to expand our healthcare capacity in our response to COVID-19. Ladies and gentlemen, as I noted earlier, COVID-19 bed capacity at all of our facilities is at a maximum, and in numerous other ways, our healthcare system is stretched. The Princess Margaret Hospital is beyond capacity with 73 COVID-19 patients and 70 assigned beds for COVID-19. To alleviate some of the strain, Samaritan's Purse will set up and operate a 28-bed COVID-19 isolation and treatment unit. This unit will be located on the grounds of the Princess Margaret Hospital at the rear of the PMH blood bank in parking lot G. This facility will accommodate positive COVID-19 patients and patients under investigation who require hospitalization. These patients will be admitted to the isolation and treatment unit through the PMH emergency department and medical staff referral process. In partnership with our healthcare workers, Samaritan's Purse will also provide infection prevention control training for essential workers, absorb the costs associated with the deployment of the unit and its support staff, and physical setup and planning sessions will continue throughout Saturdays and Sundays. The government, for its part, has committed to providing lodging, meals, and laundry service for 30 medical personnel and operation staff of Samaritan's Purse at the Malia Nassau Beach Hotel. Full quarantine exemption for staff in possession of a negative RT-PCR COVID-19 test to allow them to work. Additional personal protective equipment, if required by Samaritan's Purse, and consumables for the new COVID-19 isolation and treatment unit. The unit will start treating patients as early as the 19th of October, 2020. As with post-Dorian operations, after 6 weeks, Samaritan's Purse will transition out of the country and the isolation and treatment unit will be donated to the Bahamas. I would once again like to thank our healthcare workers for their compassion, care, skill, sacrifice, and commitment to saving lives and enhancing the health and wellness of our society. Thank you for your service. It is particularly distressing when our frontline workers contract COVID-19, and it is extremely devastating when one does not recover. Last week, the health community lost another hero on the front lines, Nurse Sherry Bain. I take this time to extend my deepest condolence to the family, friends, and nursing community that had the pleasure of knowing Nurse Bain. She was loved, well regarded by her colleagues, and the contributions she made to the health system were valued. Nurse Bain will be sorely missed. To all the families who have lost loved ones during this period, I also extend condolences and pray that God continues to give you comfort and strength today and in the days to come. We must remember, in this fight against COVID-19, we must all be personally responsible. We must be personally responsible to wear a well-fitted mask over our nose and mouth, be aware of your physical distance from others, wash and sanitize your hands frequently, cough and sneeze into your elbow, clean and disinfect surfaces regularly. And if you are sick and experiencing symptoms of COVID-19, such as fever, cough, fatigue, body aches, sore throat, loss of taste or smell, difficulty breathing, shortness of breath, chest pains, or pressure, please call your clinic or healthcare provider. Call before visiting your healthcare provider and follow the recommendations provided by the health professionals. You will be given the best advice to protect yourself, your family, and the Bahamian community. Some persons may choose to avoid seeking medical advice and monitoring their symptoms. This approach is not recommended and can possibly result in worse outcomes. It is best to seek medical advice if you are not feeling well. Again, follow the advice of the physicians and follow through with the course of care that has been prescribed. Even if you are monitoring your symptoms at home, call your healthcare provider. We must all be responsible. I repeat it again, I'll say it again. We must all be responsible. The same applies if you are caring for a loved one. Monitor their symptoms, and if there are any changes, please seek medical advice. We must be active participants in this fight against COVID-19. Follow the Ministry of Health's recommendations to stop the spread of this disease. Ladies and gentlemen, community clinics are open. On New Providence, please note that although the curfew takes effect at 7 p.m., the Fleming Street Clinic is open Monday through Friday from 9 a.m. to 8 p.m. The Elizabeth Estates and Flamingo Gardens clinics are open from 9 a.m. to 9 p.m. Monday through Friday. The Flamingo Gardens Clinic is also open on Saturdays from 9 a.m. to 5 p.m. Ladies and gentlemen, we can do this. We can stop the spread of COVID-19 in the Bahamas. May God bless you. May God bless our efforts and our endeavors. And may Almighty God continue to bless the Commonwealth of the Bahamas. CMO.
Thank you, Minister. As we continue the update, can I ask for the first slide, please? Okay, from the start of the COVID-19 outbreak to now, the Bahamas has recorded 5,517 cases. This translates into 1,417 per 100,000 population, and that is about 1 in every 70 Bahamians being affected with the virus. New Providence remains the hotspot of the archipelago, accounting for 76.8% of all cases, a near perfect mirror image of the population distribution. New cases and deaths continue to be indicators the ministry monitors to determine effectiveness of measures and to signal when a change in course might be warranted. The increase in restrictive measures implemented last Friday, or October 9th, are not yet manifesting results. It will take time to see a decrease in new cases, decrease in hospitalizations, decrease in deaths, and a downward change in the trends. Over the last 7 days, 627 new COVID-19 cases have been recorded. This represents a 12.6% increase during that period. A sobering reality is that COVID-19 is claiming too many of our loved ones. 1 in every 50 COVID-19 cases have died as a direct result of the virus. We have now registered COVID-19 deaths on 8 of our islands. Next slide. This graph is a familiar graph which looks at new and cumulative cases based on the day the test was taken. It depicts the increasing COVID-19 case trends for New Providence since the beginning of the second wave. That would be the orange line. Next slide. This graph looks at Abaco in a similar way. However, we see, based on the orange line, that we seem to be making some progress in Abaco. Next slide. Currently, there are 2,753 recovered cases and 2,218 active COVID-19 cases in the Bahamas. 56% are in New Providence, 2.6% are on Grand Bahama, 1.3% on Abaco, and the remaining spread across the other islands. Next slide. When we look at the number of days since last confirmed COVID-19 case, islands that have gone almost 2 incubation periods or more are Acklins, Maguana, Crooked Island, Long Island, and Inagua. That would be the MICAL grouping. The last time we reported to you, Cat Island had gone 50 days with no cases. This stretch, however, has been interrupted, and Cat Island is now seeing new confirmed cases. Similarly, Berry Island had gone 47 days without reporting any new cases. Berry Island is now reporting 11 new cases in the last 72 hours. After 28 days of no cases, no new cases, Bimini recorded 1 case 5 days ago. What is maybe more concerning is that Andros, Eleuthera, and Exuma are seeing new cases after having gone many days without cases. In the past 7 days, Eleuthera has recorded 7 new cases, Exuma 1, and Andros 1. Next slide. This graph visually shows the point that we are making. Some of our family islands are now demonstrating increases in new cases after a period of COVID quiet, particularly concerning Eleuthera and Berry Islands, as we alluded to. These islands have a similar trend as Abaco, which was flagged for an increase in restrictive measures last week. We remind the public that we cannot let our guards down. We are a connected archipelago, and this virus will continue to move as we move if travel protocols and public health measures if travel protocols and public health measures are disregarded. Next slide. When we look at our laboratory situation, we continue to have challenges with reporting of laboratory results within the agreed 48-hour time frame. We are working closely with all labs on a daily basis, and some progress is being made. Contact tracing cannot begin without knowing who the positive cases are and without receipt of the key information used to initiate the contact tracing. Next slide. In recent days, the ministry has reported large numbers of new COVID cases. For example, and many of us may recall, on the 14th of October, almost 200 cases were reflected in our daily release. Although October 14 was the date the results were shared with the surveillance team from the various lab facilities, it was not the date the result was processed by the lab, nor was it necessarily the date when the persons were swabbed. Looking at this graph, on the x-axis or the horizontal axis, we see the number of days from the time the sample was taken to the time a result was received by the Ministry of Health surveillance team. The y-axis, or the vertical axis, shows the number of cases. The graph clearly shows that data from October 14th, the graph shows data from October 14 only. And we see that those samples were distributed across several days. Specifically, we had 52 samples, which were 1 day old. We had 42 samples, which was 2 days old, 19 samples, 3 days, 12 samples, 4 days, and 58 samples, 5 days old. The delays in reporting leads to delays in informing. The delay has also the potential to cause misinterpretation of the current COVID-19 reality. The ministry, therefore, continues to dialogue with our labs and to underscore the critical need for timely and complete reports of the results to our surveillance team. And as I alluded to earlier, we are making good progress. Next slide. Shifting gears a bit, this slide, with this slide, I wish to bring to focus an ongoing issue with employees who test positive for COVID-19. A patient's personal health information by law cannot be shared with any third party without the written consent of the patient or next of kin or an individual with power of attorney. Personal health information includes COVID-19 laboratory test results. In conformity with the law, the ministry provides employers a letter indicating the period of isolation or quarantine for the employee's fitness, and then the employee's fitness to return to work after the period. Employers do not have the legal right to demand the COVID-19 test result. And as we seek to keep our workplaces healthy, we encourage all employers and workplaces to follow the COVID-19 workplace guidelines, which can be accessed at bahamas.gov.bs, to initiate telework policies and shift systems where possible, to ensure regular sanitizing of high-touch surfaces, to ensure masks are worn, to make facilities hand washing accessible, and to designate a human resource health and safety officer who will liaise with our contact tracers should a case be identified within the work setting. These individuals should also complete the University of the Bahamas Ministry of Health online contact tracing course, which will require a time commitment of about 3 to 5 hours. Should an employee be diagnosed with COVID-19, here are the steps you should follow. First, contact the workplace only. First, close the workplace only so that it can be cleaned by a professional qualified company. Second, trace the movements of the infected employee. Third, only those coworkers who would have had contact with the infected employee at least 2 days before being diagnosed or symptomatic should be required to quarantine for 14 days. Contact is considered interaction for more than 15 minutes within a distance of less than 6 feet and not wearing a mask. Fourth, the designated officer should reach out to our surveillance team with the name of the with the name of the case and the possible work contacts. Next slide. I again share the contact tracing link, and we encourage everybody to avail themselves of the opportunity to learn more about contact tracing. You do not need to be a health worker or a contact tracer to educate yourself on COVID-19. There is an ongoing and urgent need for contact tracers, however. And after completing the course, if you wish to express your interest in joining our contact tracers, you may email us at chiefmedicalofficer@bahamas.gov.bs. We encourage as many Bahamians as possible, from pastors to preteens, to register and take the free online contact tracing course. Finally, I remind, as the minister would have spoken to earlier, The ministry is making it easier for you to connect with the right person to get your COVID-19 questions and concerns addressed. Instead of memorizing many numbers for many services, you can now memorize only 511. Once you call, listen to the menu and choose the appropriate option depending on what you are calling for. It may be because you are a case or a contact. It may be about a work exposure. It may be about Hubcat, or because you need clarification on travel, either domestic or international, or because you have COVID-19 symptoms or other general concerns. Please, we encourage you to utilize our 511 number. With this, I thank you and open now for questions. Our team today here with us consists of the Minister Wells and myself, Dr. Nakia Forbes, Dr. Caroline Burnett, Dr. Sharita Moxie, Dr. Jillian Bartlett, Ms. Mary Walker, Dr. Philip Swan, Dr. Frank Bartlett from Grand Bahama Health Service, Mr. Lerone Burrows from Public Hospitals Authority, and Dr. DeLon Brennan has joined us. Thank you. Our first question will come from Mr. Matthew Moxie.
Yes, good afternoon. Chief Medical Officer, the former Health Minister, Dr. Bain Sands, is claiming healthcare workers are having to choose who lives and who dies at this point in the Bahamas, given the strain on hospitals with bed availability and restrictive measures on getting access to the hospital. What do the health officials have to say about this claim? Is this actually happening?
To my knowledge, healthcare workers will generally provide care to individuals as they present with particular conditions that may require that care, is the consideration for what is best will occur. But as it relates to whether or not our healthcare providers now are actually having to make that kind of decision, we have with us persons from the Public Hospitals Authority as well as PMH who may wish to speak to that question. Sorry? Oh, Dr. Forbes is also here with us. Dr. Forbes, will you speak to that question?
Start by saying that we are in a surge and the healthcare system is pushed beyond capacity as it relates to the ability to manage patients presenting with COVID-19, and it's a real challenge. As you heard in the minister's address, there are currently more patients than the capacity of Princess Margaret Hospital. There are 73 patients, but the bed capacity is in fact only 70. The absolute reality of the situation is when healthcare systems are beyond capacity, we won't be able to care for the number of patients that are presenting. Now, I will give you my experience offering care within one of these facilities that it has been challenging. On at least one of the nights that I was on call, we did have a patient present to the emergency room, and we did not have the suitable room to manage that patient. What we had to do was shift patients around, more stable patients, so that we could offer that patient this kind of oxygen and respiratory support that patient needed. I can't speak for the other facilities, but I can tell you that the reality of the situation when facilities are beyond capacity is that you could be in a situation where you could not manage the patient and you might not be able to care for a patient that needs respiratory support. Currently at the Princess Margaret Hospital, situation when facilities patients in care areas that were not designed or allocated for COVID care. including places in the emergency room and other areas in the facility where we have had to change them so that we can offer care. That is challenging. I believe the other context of the comments were that, what about non-COVID care? So we've been forced to open wards to provide COVID care. And I will give you an example of what another doctor abroad said, that every time a ward that was for non-COVID care is swapped into a ward for COVID care, you lose the ability to provide care for other persons presenting with other problems, which I believe was referenced in the article. At this time, I haven't seen a patient die because we haven't been able to support them and pick someone else who has had to live. But I will tell you, the reality of the situation is, if we continue beyond capacity, those difficult decisions may have to be made.
Thank you, Dr. Forbes. Next question.
My final question is, with so many different labs conducting testing now, how are you sure that these numbers are truly new cases and not a duplicate from a person that has already tested positive and went to get a repeat test to come out of quarantine who is still positive?
Okay, the simple answer to that would be, as a part of our data management and our data cleaning, we do a deduplication, which means that we go through the information that is received and is put into an electronic database, and we remove the duplicates. Dr. Moxie, I don't know if you would wish to speak a little bit more about the process.
Good afternoon, everyone. So thank you for the question. And yes, there are instances, as we know, where one person could be tested many times. The data management process that we have in place at the surveillance unit in the Ministry of Health is such where we are able to identify individuals who would have had multiple tests. And so whenever we report to the public on new COVID-19 cases, you can trust that the process is robust and valid enough that we're picking up those persons who are new to the system. Our digital platform does allow for us to indicate whether it's the first test, the second test, third test, so forth and so on, of a particular individual. Thank you.
Amajal Knowles.
Good afternoon.
Good afternoon.
Earlier this week, in an interview with local daily health officials, were calling for stricter lockdowns amid the spike in cases, but this seems to be in direct contrast to recent comments from Dr. David Nabarro, WHO Special Envoy for COVID-19, who's actually urging world leaders to move away from lockdowns as the first defense to try to curb the spread. My question is, why are local officials calling for more lockdowns when international ones are saying that this isn't necessarily the way to go?
Well, certainly lockdowns have been used in order for us to sorry, lockdowns would have been used early in our first wave, in part because we required the time to be able to do what was required to build the capacity as best we can to manage cases and to enhance our surveillance mechanisms and other issues that we needed to deal with. What lockdowns do is decrease the likelihood of the spread of the virus. Now, our lockdown in our first wave was a full and complete lockdown. As it relates to what we are in now, we are in restrictive measures, not necessarily full lockdowns. So we have increased restrictive measures in part to do the same thing that we would have done during the first wave. The article that you are referring to, if you would, my recollection on reviewing it, referred to full and complete lockdowns. Certainly, none of us would wish to impose full and complete lockdowns on our entire population, but when it's required for us to ensure that we move in the direction of decreasing the spread, restrictive measures, and in that article, I believe that it was referred to as, advisable or certainly not something that could not be done as we go through the pandemic. And we see that across many countries, it's actually occurring in part because of the need for us to manage the cycles that we find ourselves in. So long and short, full lockdown, we are, as the article referred to, we're not in a full lockdown. We have just enhanced our restrictive measures in order to give us a little decrease in the likelihood of spread of the virus. And I think certainly given our capacity, our health system capacity that the last question spoke to, and other measures, the requirement to do that, I think would be understood. Next question.
Okay, my second question would be for the minister. Can we just get an update on the nurses' situation, as union representatives have previously expressed their frustrations with the shift system as well as overtime pay?
I will let PHA speak to that issue because I was informed that some of the issues had to do with PHA, and we did have a discussion with those circumstances in regard to the nurses.
Good afternoon, and thank you for the question. As it relates to the Public Hospitals Authority, we have categorically reviewed this particular matter, and we can state that we have not changed or implemented any shift system that is new or any attempt to eliminate the 4-on-4-off system that is in place. Instead, we attempted to increase the number of shifts that were available given the number of nurses who are currently out either on isolation or by virtue of quarantine. Based on the surge of cases within the Bahamas, we attempted to increase the number of nurses who would be able to utilize the shifts that were currently in place. As a result of that, we have been in dialogue with the union as they saw that we were attempting to implement a system that would eliminate the 4-on-4 system. What the 4-on-4 system actually does is it reduces the number of nurses that are in play to provide coverage up to about 25%. We had a cadre of nurses who had been appointed to the PHA whose contract allowed for them to work 8-hour shifts. With the 8-hour shifts, it would not present the opportunity for the 4-on-4-off shift to be in place, and therefore we would be in a position where we would have significant improvements in coverage. Once this matter was brought to our attention by the nurses union, we reviewed it and we have made a decision that for the time being that we will not move forward with this new 8-hour shift at night. As a result of that, we will have some challenges in terms of providing the necessary coverage. We've also seen that the nurses union, some of the nurses have been calling in sick over the last week or so, and as a result of that, we've had some challenges in terms of providing full coverage. We also note that we have attempted to eliminate the changes that would have been implemented over the last week. However, it would have created more disruption if we were to eliminate or reverse that during the course of this week. So we anticipate that this will be concluded by the end of this work week, and effective Monday the 19th, we will go back to our normal schedule. Thank you.
Mr. Kyle Joaquin.
Good afternoon. I know Dr. Forbes says she doesn't know of any cases where a patient died because they couldn't be cared for, but it has been reported by the former health minister that we're at a point where healthcare personnel are deciding who lives and who dies. Just want to know, how are they making this determination? Is it by age, et cetera? And as well, we're hearing once again reports of people coming into PMH and in some cases dying while waiting or being unable to get assistance because of the fear of COVID. So I just want to know any confirmation or what measures are being put in place to avoid this from happening.
Certainly, Dr. Forbes would have provided, I think, a very good response to that question. Dr. Burnett, do you wish to add?
Good afternoon. So the management of COVID-19 patients is much the same as any patient that presents to the Princess Margaret Hospital. In the accident and emergency department, we do a triage of all patients that present, and we categorize from 1 to 5, depending on severity. It's determined by vital signs and the condition that they're presented with, so they're presenting complaint. So all patients are triaged and then sent to the necessary area for management. If it's a resuscitation room or if they're actually triaged away to a clinic because it's not an emergency situation. So we have been having challenges due to beds being out, basically shuffling patients between beds, between a critical care bed and an ambulatory area, but we have been doing our best and managing that way. Thank you.
Do you have a second question?
Yes, ma'am, I do. ICU in particular, is that maxed out? And if so, how many ventilators do we have? And what happens if a patient needs one and they can't get one because of your overcapacity?
Okay, Ms. Walker is here. Certainly, she would be able to give you the specifics.
Good afternoon. Once again, thank you for the question. With respect to our capacity for ventilating patients that require it, we do have the capacity to do that, and it can be done on several wards within the Princess Margaret Hospital. At this time, we have not exceeded the capacity of ventilators to those of the demand for ventilators. Likewise, in Grand Bahama, there is also the facility for persons who require ventilation. So at this point in time, if I'm remembering the data correctly, we have approximately 65 to 66 ventilators in country at our disposal, and we have not put all of those in use. Given the fact that we are taking care of other persons who require ventilatory support other than COVID patients.
And I also remind that we have the Doctors Hospital Health System that is also included in our capacity to provide care to our COVID moderate to severe COVID patients, which includes additional ventilatory support. However, I believe it's becoming very clear, as we would have said early, and we have continued to say, as the cases increase, our hospital capacity will be stretched. Our capacity to provide care for other conditions and also to provide care for COVID-19 patients will become stretched. I believe what we are ventilating right now is exactly that. We are stretched to provide the care, but we are continuing to provide care to individuals as they present with various health conditions. Mr. Shamarko Lightbourne.
Hi, good afternoon.
Good afternoon.
Marco Lightbourne. My first question concerns the geographics of hotspots on the Family Islands. In the past, the ministry had shared some mapping data on the major hotspot islands such as Nassau and Grand Bahama. Is that yet possible with some of the Family Islands that may have fewer cases, just so the public can make more informed choices as they roam their islands?
Oh, the BNGIS, the mapping. We continue to work with our colleagues at BNGIS who would have actually provided the maps for us. We did not move to having those maps updated recently, and certainly the maps that would have been shown, I think, in about 2 or so press conferences ago, had a number of gaps, in part because of the exact data points that's required. But we can reach out to BNGIS again and see if we can have those maps populated as best they can and present them to the public.
Thank you kindly.
Next question.
My second question is simply a follow-up to an inquiry I made several weeks ago I inquired if the ministry could augment the data on the dashboard so we could see recovered cases by island. Do you know if there's any progress on that as yet?
Yeah, okay. So certainly what we would have done, and they're reminding, we would have shown in one or two of the graphs that we presented, and also what we are doing now is revising, as the minister would have alluded to in his remarks, we are revising the way that we will be providing that information to the public. And certainly the intent is to be able to incorporate more of that detail. So what I would suggest is that you continue to monitor, and we should have the revised version coming to the public very shortly, which will include more of a prose that speaks to some of what you are asking for. But the information is available, and sometimes I say, we can make it available to you, and then I walk away from the press conference and forget to do so. But we have the information, and we will be able to make it available to you. And as you see, there it is. We can provide that graph, the table to you today, but we will be able to provide additional information such as that in the new way as we move forward with our revised dashboard. Leandra Roll, Ms.
Good afternoon. So you mentioned that a number of islands, specifically Eleuthera and Berry Islands, that have been seeing new cases in recent weeks, and you said that this is quite concerning for health officials. So if that trend continues, does that mean that we can see more restrictive measures being implemented on those islands?
Certainly, I would ask Dr. Bartlett to speak to what we are actually seeing on those islands. But the whole purpose of us monitoring those trends is to be able to make the necessary recommendations with respect to decreasing the likelihood of a surge on particular islands. And as we begin to see those things, we will go ahead and make our recommendations with respect to how we can actually manage the increase in cases on the particular islands. Dr. Bartlett, are you Dr. Jillian Bartlett?
Yes, good afternoon, Bahamas. I'll speak specifically to the two islands mentioned, and that is Berry Islands and Eleuthera. Let me start first with Eleuthera. So Eleuthera, we have seen a surge on uptake in cases and with PUIs as persons under investigation presenting that are symptomatic, mostly between Central and South Eleuthera. And so, yes, we have made recommendations based on what we're seeing in the numbers and what's happening operationally on the ground, that we would have more restrictive measures put in place in Eleuthera, mainly that area, the Central and South, based on what's happening. So yes, to your question, and the same would also be the recommendation for the Berry Islands, that we're also seeing an uptick in cases. Thank you.
Thank you, Dr. Bartlett. Dr. Bartlett is responsible for monitoring of all of our family of islands, and certainly the recommendation that she would have referenced relates to the recommendations that will come as she updates the Emergency Operations Center. Now, certainly those recommendations, then we have a responsibility for passing it on, and certainly our data is what we will use to support that kind of recommendation moving forward once we have completed the review of our data. But what she would have said is that we have concerns in Eleuthera currently based on the daily monitoring and working with the healthcare providers on the ground, and that is a cause for concern. So we continue to monitor, recommendations come to the EOC, and then we review the data and move forward with other recommendations. Do you have a second question?
Yes, I do have a second question. So we know the country is also slated to reopen its tourism industry in a few weeks' time, and I know that you've already said the officials have already said they have not yet seen a flattening of the curve for New Providence, and as you mentioned earlier, islands are seeing new cases. In light of that, do you feel that the country is ready to reopen, especially considering that health officials are already calling for more stricter measures for New Providence?
Okay, so I'll let Minister start, and then I will speak, I will say.
The government of the Bahamas, in seeking to be responsive to the needs of the Bahamian people, are seeing how it is that we can best both manage the survivability of our economic life, as well as the physical life and livelihood of the Bahamian people. And so, whereas we are receiving advice as to what needs to take place within the health sphere, we're also taking all of that into consideration in the decision-making process. Obviously, as a government, we're never going to do anything that's going to overtly endanger the lives of our people. But we do believe that we are on to a model, a formula that can work. If you look around the globe, we have surging cases of COVID in Europe, in Asia, in the Middle East, in Europe. Just last week, they had over 700,000 COVID positive cases, 100,000 COVID positive cases a day. And you would see that nations such as France has instituted what we are now doing, a curfew from like 7 p.m. to 5 p.m. You'd find like the Netherlands are restricting the amount of persons who can gather together, 30. The Czech Republic is restricting movement across its borders. It's instituting a state of emergency. You have the Kingdom of Jordan. King Hussein in Jordan is now having weekend lockdowns. You had Israel that is just coming out of a 3-week lockdown. Nations are seeking the best ways that they can deal with this pandemic while also seeking to keep some sense of livelihood, some sense of viability of its economy and the life of its people. And so here in the Bahamas, we're seeking to do the same thing. And this ministry, the Ministry of Health, is working along with tourism to be able to see how we can get that best fit so that we can protect the lives of the Bahamian people while creating the economic livelihood of the Bahamian people as well.
Thank you, Minister. Christina Dragovic?
Yes, Dragovich.
Dragovic.
Good evening.
Good evening.
The Pan American Health Organization recently raised concerns over the number of cases in the Bahamas, which are continuing to rise, as well as the number of younger patients who are testing positive for the virus. Do we have any statistics about pediatric patients and what resources are available for them?
Okay, so yes, we do. We keep, our data actually includes all age groups. I do not have that in front of me, but we are monitoring the pediatric age group. That would be from 0 to 19, and I can't recall, I don't know, do you have no, nobody has the updated number, but certainly we would not have had many of our, I guess the majority of our cases would not have been in that age group, but that is an age group that we are monitoring, and certainly we have also made provision to provide that data to pediatricians at their request in order for us to ensure that we are monitoring that age group as best we can.
Your question? Do we have the resources to support the number of tests that would go hand in hand with a full reopening of the country? And that also includes beds, ventilators, and PPE.
Okay, Minister, did you want to take that? Okay, oh yes, Dr. Brennan is on, is he on the Zoom? Is he on the Zoom? Yes. Yes, Dr. Brennan?
Yes, ma'am.
Would you take that one? Mm-hmm.
Yeah, absolutely. Thanks, Mr. Dragovich, for the question. So we continuously look to see what our capacity is in country, and we monitor the inventory very closely. As you know, we are partnering with not just our public resources, as in the Princess Margaret Hospital, the Rand Memorial Hospital, and the National Reference Lab to do testing, but testing is also taking place in many of our private laboratory facilities. And so we have a constant dialogue going on with that grouping. We met with them as late as this morning to continue to make sure that we have enhanced lab capacity available, and we are continuing to make sure not just the capacity is maintained with the real-time PCR testing that has become the gold standard in country, but we also want to make sure that we're keeping our fingers on the pulse of the more advancing technologies when it comes to rapid testing as well. And so as we continue to monitor those and those are introduced in country, we want to make sure they are done in a responsible manner, not just for volume, but making sure we're doing quality testing as we go along with it. So we do think we have a very robust infrastructure in country to be able to enhance what laboratory and testing capacity is available, not just for when we open, but also for what's going on in country, the growth in movement within islands, within the individual islands, between islands, and then people moving into and out of the country at the same time. So while that infrastructure is robust at present, we are always looking for continued growth, but doing so in a responsible manner. Thanks.
Thank you, Dr. Brennan. And certainly to update on your previous question, we have 180 cases that are 19 years old or less. So that would be our pediatric grouping. Tyler Simonet.
Yes, good afternoon to the health officials and to everyone who's listening. My first question is, the World Health Organization released a study today that the antiviral drug remdesivir has little to no effect on COVID patients' chance for survival. Can health officials provide an insight into this? Is remdesivir completely out of the run for COVID-19 treatment? And if so, do we have any idea on what the next drug health officials plan on testing out is?
So Dr. Forbes is working closely with that. I'll ask her to answer the question, please. Dr. Forbes?
Good afternoon. Thank you very much for that question. As a reminder, there was preliminary study data released on remdesivir a few months ago that also found the same thing, that there was not a mortality benefit, but it did shorten the duration of illness that persons with COVID-19 experience their symptoms for, from 14 days down to about 10 or 11 days. And again, there was no mortality benefit. This newer data is also in keeping with that and supports that. And so that is the same information that essentially remdesivir is not a cure for COVID-19. It won't make you be more likely to live versus not live, but it does have benefits because it shortens the duration of the illness. At this time, there's no cure for COVID-19. It's largely supportive care. The antiretroviral, the medication remdesivir can shorten the duration of symptoms. There are other medicines that can be helpful, such as steroids for those that have oxygen requirements. And we continue to wait for the information from ongoing studies about other agents. As a reminder, there are expert guidelines for the treatment of COVID-19 in country that the Bahamas is also using for the treatment of the patients.
Thank you, Dr. Forbes. Do you have another question, Ms. Simonet?
Yes, I do. Thank you so much for that. My second question is in regards to the 2020 census that was due to happen in September, but it's been postponed. But the acting financial secretary, Marlon Johnson, said that without a doubt, the census is still going to happen. I just wanted to know what recommendations are health officials planning on giving in regards to that when the issue will be presented to cabinet next week.
Okay, certainly I'll start and then I'll let Minister add if he wished to add. We have persons within the Ministry of Health that historically form a part of that grouping as we plan to do a census. So certainly the review and the revision and the decisions as it relates to how we can best have a census conducted during this COVID period, I anticipate will be incorporated in any discussions at the health level with the statistics persons. As it relates to cabinet, I would allow Minister to speak to that.
I would simply add that, as you would have just said, and the Financial Secretary would have intimated, by law, every 10 years, the country has a national census where we collect the requisite data on the amount of Bahamians we have in country, their income, and other data for statistical analysis. And the government of the Bahamas will be seeking to conduct that census as best as we can, given the challenges that we have with COVID. That census data tends to inform decisions, especially with boundary cuts and in regards to elections. And so the government of the Bahamas will be moving forward, as I just said, rightfully so, as best as we can, keeping in mind the requisite health protocols and guidelines.
Royston Jones.
And Royston Jones, Eyewitness News. Notwithstanding Dr. Brennan's assurance of the Bahamas' robust testing capacity for this phased tourism reopening, Harvard Institute experts have suggested that 152 tests per 100,000 people is a safe level for reopening. That equates, as has been pointed out in previous articles, to about 600 tests per day. In the last 2 days, testings increased from 25,585 to 26,150 as of Thursday. That's 565 tests in 2 days. So despite this increased capacity for testing, the question is, why is daily testing figures below these recommended figures? And why are the numbers being reflected from testing appear to be lower than our max capacity described in August and September?
Okay, Dr. Brennan.
Sure, thanks. I think we realize that testing and the testing numbers as to how many people are tested is a multifactorial issue. It is dependent upon a number of things. You know, as everyone knows, we have a national protocol in place when it comes to public sector testing, and the way we conserve our resources to make sure we will have the laboratory capacity to be able to do this moving on into the future. And in addition, there are persons who present themselves for testing in the private sector that don't require necessarily that same protocol. So it's not as if all of the testing comes from one particular area, one particular approach. It is truly multifactorial. So one has to consider the protocol-based approach that goes out and searches out persons that need to be tested or who present to healthcare facilities to be tested, and then those who are testing whether for work or for travel or for other purposes. And so our numbers are made up of a combination of things. While we do have capacity, it also is that we need to have people present themselves for testing who are either symptomatic or who need it for other purposes. So it's really not necessarily a reflection on demand. It is mostly a reflection of supply. It is a reflection of demand, who is presenting themselves for testing. So as persons continue to present themselves for testing, we get more testing done, those numbers would be expected to rise concurrently. Thanks.
Okay, thank you, Dr. Brennan. And I'm being reminded that based on our current numbers, per 100,000 testing is way above the 152 that you mentioned. So we would not say that we have the capacity, the full capacity that's required, but based on our protocols and based on the numbers that are being provided, we are above the 152 per 100,000. Do you have a next question?
I do, thank you. At some point, it would be great to get an exact number of where we are with the 100,000 testing capacity. That exact number you mentioned, always way above. That'd be good to get.
Based on the number that was just provided from the surveillance team is 6,704, 6,714 per 100,000.
Right. My second question, if I can, is the Prime Minister has spoken previously to debilitating long-term health impacts of COVID-19 while encouraging adherence to the health guidelines. What does the data about the recovered cases say or speak to in terms of these long-term health impacts as a result of the virus? How severe are they, and what complications are we seeing locally?
So I will ask the clinicians, Dr. Burnett, Dr. Forbes, to speak to that, please. Dr. Forbes?
Good afternoon again. So as an overview, there can be long-term health consequences of COVID-19. There can be lasting lung damage. Persons may have reduced lung capacity, their exercise tolerance may go down. There's also some information that the cardiovascular system, the heart and the blood vessels around the heart can undergo inflammation. That's the information that we have to date in our global experience. As we continue with our journey of COVID-19, we'll find out if there is more. From some of the patients that we've seen, a few of them do require oxygen for some long periods of time, including after they've left the hospital and they have to go home on home oxygen therapy. There aren't many patients like that. There are probably below 10 in number, but as I said, we're still monitoring a lot of these patients, and we do not really know for sure what are the long-term consequences of this virus that may be manifest years from now. That's what I can share with you to date.
Thank you. Ms. Jasper Ward.
Good evening. My first question, the World Health Organization has advised governments that before reopening, rates of positivity and testing should remain at about 5% or lower for 14 days. The Bahamas has a positivity rate of roughly 21%. Is it safe for our country to reopen the economy and the tourism sector with a positivity rate more than 4 times the recommended number?
Certainly, I would begin. When you speak about the recommendations, I think each sovereign country will have to weigh, what the requirements are in their particular country. The Bahamas, as the minister alluded to a few moments ago, we are a tourism-dependent country, and we have to balance the whole public health concerns with, being able to open up the economy. Now, the recommendation of 5%, we take it for what it is, and certainly, as alluded to, we will be seeking to enhance the capacities and look at ways that we can safely do what is required to ensure that the people of the Bahamas are in a position to, maintain their livelihoods. We have to balance lives with livelihoods, and this is not a very good position that public health finds itself in, or the country. But I would allow Minister to add to that if he would wish to add. No? Okay, next question, please.
As of October 14th, we had the locations for 228 cases still pending. What has been the holdup with the location pending? When can we see the locations for those over 200 cases?
I'll let Dr. Moxie or Dr. Swan speak to that. They work with SharePoint closely. Okay, Dr. Swan.
Good afternoon. Thank you for your question. However, we have addressed this or tried to address this a number of times in previous press conferences. The challenge is that when we receive results, they sometimes do not have the location of the individuals who would have been tested and tested positive. In addition to that, they may not have telephone contacts for us to reach those individuals to find out where they live. That doesn't change over the course of time. So if you didn't have the information on day 1, it's not going to become available on day 21. So if they are location pending, means that we don't know exactly where this individual is from when the test was done. That's not going to change unless that person is either retested with the same date of birth, and that new test now has a location on it that we can verify that it may indeed be the same individual. But until that happens, the numbers will remain as they are. We don't want to make up data so that you can get an idea that the number is lower. But if you look at it, 218 is about less than 5% of the total overall number of cases that are reported. And in the grand scheme of things, it's not going to change specifically or significantly our epidemiological profile of those cases. So thank you.
And I just wanted to chime in a little bit on the question that was asked earlier in regards to tourism and even the positivity rate. You would see a lot of countries around the globe, especially first world nations, the United States, Europe, I think with the exception of China, most of the first world countries where you have the vast majority of resources, of manufacturing capability, the vast majority of financial viability and wherewithal having positivity rates that would be considered challenging by the WHO. And so I believe that all countries are seeking to be able to find that best fit, as I would have spoken to it earlier. And the Bahamas government has taken a decision that we're seeking to open up our economy more so around November the 1st. And we are looking along health and tourism are working to create what we would call sort of bubbles. I think you would have seen some of that in regards to the NBA championship and what is taking place within the football arena, where you try to carve out a space where you try to keep that space, that place as safe and sterile as possible for persons to be able to operate within that space. And so we do believe that we can get solutions that both allow us to have some sort of economic viability while also seeking to address and to flatten the curve of COVID going forward.
Thank you, Minister. Elizabeth Bryan, Mrs.
Good afternoon. How are you? Good afternoon to everyone. Elizabeth Bryan here with the Return newspaper. Thank you for providing that some more detail on the case information in Eleuthera in terms of recovered and active. But I wonder if I could ask Dr. Lillian Bartlett if she can share, if she has the information in this forum today, a quick breakdown of where the 30-odd confirmed cases are within the districts within Eleuthera currently.
Yes, good afternoon, Ms. Bryan. So the breakdown of, if you look at the dashboard, is showing there are 30 cases in Eleuthera. Of those 30 cases, we have 4 in North Eleuthera, 1 Harbor Island, 2 Spanish Wells, and 1 on the mainland. And we have a total of 26 in the southern end, that being 13 in central Eleuthera and 13 in south Eleuthera, for a total of 30 firm cases. Thank you.
You have a second question?
Dr. Bartlett, really appreciate that. My second question, we've learned of inquiries being made to hospitality operators in Eleuthera who have guests booking for November, who are asking about where those guests will be facilitated on the island to take the 5th-day rapid antigen test, a new requirement announced by the Ministry of Tourism for tourists staying in the Bahamas for more than 4 nights. Would you have any information as the Ministry of Health on this so incoming guests can be guided appropriately?
Dr. Brennan? I think you're working.
Yes, ma'am. So I was trying to understand the beginning of the question. I heard about the tourists spending more than 4 nights, but can you repeat the beginning of the question, please?
For family islands such as Eleuthera, where will persons actually access?
Hello?
Hi.
Yes, I'll repeat the question for Dr. Brennan. Basically, some of our hospitality properties have been getting early bookings for November for the island, and some of those tourists are inquiring about that 5th-day antigen rapid test requirement that the Ministry of Tourism recently announced, and they're wondering where they're going to be facilitated on the island for that 5th-day testing, like where they will go to get that test onto an island.
Sure. The Ministry of Health, the Ministry of Tourism, we are the plan, given that this additional testing is expected to be put in place both for the day of travel testing along with additional testing while persons are in country is a policy that was put forward, and currently we are working on putting together plans as to how that can happen between public sector facilities and private sector facilities in order to help accommodate that. And so while I can't give specifics right now as to where in Eleuthera that will happen, it is expected that those testing capacities will be revealed as we get closer to the date. So I would look for additional information to be put out by Ministry of Tourism in order to help those properties to be able to advise the travelers as they come in more appropriately.
Thank you, Dr. Brennan. And Mrs. Karen Bain.
Pleasant good afternoon.
Good afternoon.
Karen Ferguson Bain from Global 99.5 FM. We have received reports that persons have been waiting for their COVID-19 tests for 3 weeks. Is it possible for the Ministry of Health to find a way to correct this, as it could prove fatal for persons that they come in contact with as a result of waiting for their tests? What are the challenges that brought about the delay in the test?
So I think you are breaking up, and I'm not hearing the full question, but I believe you are asking how we can begin to address the delay in getting test results. In the presentation that was made, we alluded to the challenges that we are also having as a ministry in receiving the results from our lab partners. Now, there are a number of processes after a person actually presents themselves to a lab to actually have a specimen taken, to getting it reported to them, as well as having it reported to the ministry. No longer than this morning, we sat with a number of key labs, and we, had the discussion along the lines of how we can enhance the processes within the laboratories as it relates to, the process for testing and getting the result to individuals, as well as getting the results to the lab, to the surveillance team, so that we can initiate our contact tracing. Other than, working closely with our partners and, consistently making them aware of what the challenge of delayed reporting means as it relates to COVID-19, we'll have to continue to work with them, and we are making some progress, but I understand your concern if it's taking, upward of 2 weeks to get the result. I'm not sure if anyone else on the team would wish to speak to that question. Okay, that's a no. Do you have a second question?
Yes, ma'am. Thank you very much. Dr. Forbes conducted an online training regarding COVID-19 in the workplace. However, numerous government agencies in New Providence had to be closed for deep cleaning due to employees who have tested positive for COVID-19. What are the government's plans to contain this infectious disease in its agencies?
Is your question to Dr. Forbes, or can you repeat your question, please?
The question is, Dr. Forbes conducted online training regarding COVID-19 in the workplace. However, numerous government agencies in New Providence had to be closed for deep cleaning due to employees contracting COVID-19. What are the government's plans to contain this infectious disease in its agencies?
Well, certainly I will begin, and any others on the team can provide additional information. But as it relates to workplace safety, early in the COVID-19 outbreak, the Ministry of Health would have worked closely with a number of other agencies to put together a workplace guideline with respect to how you can actually assess your workplace, and also what are the things that are required in order for a workplace to function safely during COVID. Most recently, certainly the orders speak to in the public sector for sure, actually, and in the private sector, having persons work remotely as far as possible. That is one of the measures that we believe that will begin to, influence positively the number of cases that are associated with workplaces. COVID-19 is about contact, and if we put in measures that decrease the likelihood of persons being in contact with individuals who are asymptomatic or symptomatic, or the high touch surfaces that touching and then transferring to oneself. When we put in place the recommendations for a combination of those public health measures within the workplace, we anticipate that those measures will begin to decrease the number of cases that we are seeing associated with workplaces. And then we go back to the part where the individual component, wearing masks, ensuring that you physical distance, and certainly what our data would have shown us as we go through is many of the cases are actually introduced to the workplace after having had exposures outside. So it's something that we have to do collectively, and we have to be mindful of. We would have, in the remarks that were made, actually encouraged individuals to go online and look for the workplace guidelines that we have at bahamas.gov.bs, as well as to encourage the human resources personnel and other safety officers in workplaces to become actively involved in understanding how COVID-19 is spread and what can happen in workplaces and what should happen in the event that we have the introduction of COVID-19 or asymptomatic person in the workplace. So long and short, we have to continue to follow the public health measures as best we can, not just in workplaces, but outside of the workplace. And we collectively will need to be meticulous about how we move around as we begin to have conversations around opening the economy and living with COVID-19. So with that being said, I think that was our last question, and Minister would wish to speak.
Certainly, just let me say, I've just been made aware, and the government of the Bahamas is no respect of persons. We value each individual's work, each are of equal value, and I was just informed that we would have had a support staff who passed away at PMH on September the 29th, Miss Marion Burrows McKinney, and in my remarks I would have spoken to the nurse who would have passed away. And on behalf of the government of the Bahamas, I want the family of Miss McKinney to know that we do offer our sincere condolence on her passing. She was a valued individual inside the work at PMH, and we want the support staff to know that we value their work as much as we value the work of nurses and doctors in this healthcare sector. And we will continue to do all that we can to preserve all of the lives, both of the persons in the healthcare sector and of the patients who are presenting themselves for our care.
Okay, so thank you all for joining us today for the update on COVID-19. And as we wrap up now, I just encourage everybody to be safe and to be mindful of all of our actions and all of the measures that we need to consistently practice in order to make our environments safer and to protect our lives and our livelihoods. Thank you.